It is National Napping Day, and believe it or not, a solid nap is actually
Yeah.
good for your health.
Yeah, so if you're wondering about the do's and don'ts for catching a little shut-eye, we've got just the person for you.
That's right. Dr. Adrian Pristas is Hackensack Meridian Health's Director of Sleep Medicine. So, Doctor, thank you for being here this morning.
Good morning, Hazel and Dan. Thank you.
Yeah, so the fact it's National Napping Day is because it's the first Monday after we turned our clocks ahead over the weekend. So are people more likely to need a little nap because of that?
Well, sure. There are a lot of people that have great difficulty making that adjustment from the hour lost sleep over the weekend. Most people do okay in a day or two, but there's some people that go on for a couple of weeks because they're really thrown off.
Wow.
So it is a common issue, and that's why in 1999 a couple from Boston started this day, National Napping Day.
Yeah, so when we haven't moved the clocks, does the fact that we may need a little nap during the day mean that we're not sleeping properly? Like, daylight saving aside, if you need a daily nap.
That's an excellent point, and that is the crux of this argument. If you don't get a good night's sleep, you will need a nap, or at least feel like you need a nap. And that's where some of the health issues come. If you're napping, you have to be honest with yourself and understand that you may not be getting a good night's sleep. So it's not the nap itself that's harmful. It's the fact that you might not be getting a good night's sleep. And that comes with the risk for blood pressure issues and cardiovascular events and all kinds of other health issues that come down the pike years down the road. So the need for a nap regularly is probably not healthy for you. The flip side of that, however, though, is that a power nap, as we like to call them, can be helpful.
Yeah.
Back in the 90s, NASA did a study on this very topic.
Yeah, well, that's interesting then. So are there times of the day that we should maybe or shouldn't nap, or does it really depend on your personal body rhythms, maybe even your work schedule, like hours? I mean, we sleep at crazy hours and get up at crazy hours, so.
That's why we need a nap.
So you do have to get a good night's sleep. That's rule number one. That's always the answer.
What's a good night's sleep?
A good night's sleep is 7 to 8 hours for an adult.
Yeah, that's not
we're a little bit nutty around here. We do less than that, but really it's still 7 to 8 hours. And that power nap can be helpful. It can be rejuvenating. It can be a place where you can go to relax a little bit, take some stress off. There's some evidence that says that it helps with reaction time and your mood and your ability to use critical thinking, help your memory, finish the day out stronger, things like that. So if you get a good night's sleep and you set 15, 20 minutes aside to just relax, maybe you do nap, maybe you don't, it can be helpful.
But what about when you have schedules like ours?
Right.
Like Dan and I, or even people that work in the medical field that are working all night, and you don't get good sleep. Is there, just an actual straight through sleeping pattern? Is there anything we can do, or are we just kind of out of luck?
For Hazel and Dan, you have to stick to your schedule best you can, even on the weekends. And as a result, if you do that for several months, your circadian rhythm is going to adjust itself, and you will get up and go to sleep at the same time. Your day will be a little different than most people, but you should do well. With that said, your point is excellent in that we are a world of shift workers now. So a nap could be a strategy to reduce work accidents, driving accidents, and things like that. So you can talk to your physician about how to negotiate your week and incorporate some naps to keep yourself safe.
Yeah, I'm hard pressed to find somebody who actually gets 7 to 8 hours of sleep. It seems like any adult I speak to, it says, well, yeah, I get maybe 6, if it's a good night. But you brought up a point, you said a power nap, right? So how long is a power nap versus how long is a regular nap? Because the whole argument of what a nap is, some people say it's 20 minutes. So how does that differ from a power?
Well, there's not a lot of data out there, but certainly 15 to 30 minutes is a general idea out there in the literature. And I think the strongest evidence is what NASA did with their astronauts, because they do a 26-minute, that's the number they came up with. I 26. Can't help that. 26-minute nap, and it helps with reaction time and alertness.
Is that a power nap?
So that's kind of a power nap. Now, whether the astronaut actually went to sleep or not, it was the time set aside to relax and try to go to sleep. Now, a lot of them didn't, and a lot of people won't nap because they can't. If they got a good night's sleep, it's hard to take a nap. So at the very least, you relax you get your mind off things a little bit and help yourself move on to the rest of the day.
So I'm curious though, is there a difference between men and women when it comes to napping?
Not really. I will say though, the men and women have slightly different issues. Men tend to have more sleep apnea, and 15% of this country has sleep apnea, and most of that's not treated. Women tend to have more insomnia, and that occurs after menopause, and it's not just about the hot flashes. There are other issues that go on. So insomnia and sleep apnea are just two examples of why men and women are a little different, and why they both have their own set of struggles to get a good night's sleep, especially as we get older. One other thing I wanted to bring up is that when we hit about 60, our sleep is usually fragmented. It doesn't have to be a bad thing, so long as you get up feeling refreshed.
Yeah, perhaps that person that has insomnia is married to someone with sleep apnea.
And that's the cause.
But what do you tell people who, for us, for Hazel and I, we could take a nap theoretically, if our kids are, we're not around. But what advice can you give people who don't get that 8 hours of sleep, which is the majority of folks, but are not in a position to take a nap because they're like a 9-to-5 worker?
Well, a lot of insomniacs don't have the capability to take a nap. But if you have the opportunity to take a nap because you had a bad night's sleep, which isn't your norm, then there's nothing really wrong with that. As a matter of fact, senior citizens who occasionally have a bad night's sleep, there's evidence that a nap is cardioprotective. So, the reality for somebody like you two is that, you may have to just accept that a nap is acceptable because your sleep schedule is what it is.
Yeah. Or we just keep the coffee places in business.
You just do the best you can. And by the way, coffee is not a mortal sin. Coffee is okay. You just have to understand that you should probably stop around noontime. And the other thing is that hydration. You should stop coffee around noontime.
Oh.
So you get a good night's sleep. And because what it does, it counteracts adenosine. And if you eliminate that, adenosine is part of the way we go to sleep at night. And if you don't allow that to build up in your body, you will have a difficult time falling asleep at night.
Very good.
And the other tip is hydration. Hydrate in the afternoon. It does cause fatigue. So, you get that kind of lull and you don't feel that great. So just make sure you hydrate in the afternoon.
Hydrate with water, not with wine. Dr. Adrian Pristas, thanks so much. Director of Sleep Medicine at Hackensack Meridian Health. So great having you with us. Now go take a nap.
Right.
Thank you. I will.
All right.